Okay, good evening, everyone, and thank you for joining us. Tonight we have Sue Mannos with us from Runway Recovery in Santa Ana, California. Sue is the Clinical Director for Runway and has been since they opened. Sue began working in treatment in 1994 and has been a Clinical Director since 2019. In addition to her work in addiction recovery, Sue also has a private practice where she specializes in mental health, trauma, and addiction. Tonight, she'll guide us through the therapeutic aspect of addiction recovery and how that could be helpful to our loved ones. Thank you, Sue. We're so glad to have you and look forward to learning about this little known resource of the recovery journey. If you're ready, let's jump in.
I am. Thank you. Right out of the box, I just want to say thank you for letting me be here. It feels nice to be a part of this. My hope is that I can offer something that will support a new way of looking at things or open a door to another avenue on how to cope with a family dealing with addiction. I started working in treatment in 1994. At that time, I was a mom of one, which is kind of hilarious because I ended up having six kids. But back in 94, I met an incredibly kind man in the community who owned a treatment center. Sorry about that. And he asked me if I wanted to join them and come work um, for his treatment center. And I did. I did want to. And I realized when I walked in that I was home. I can't describe it, but this was a feeling of being a part of supporting good people struggling with, an awful disease. My love for the patients was deep, and my connection was incredibly sincere, as it is to this day. As a therapist in private practice, I specialize in trauma, mental health, and addiction. I'm also a clinical director, as you said, at the Runway Recovery, and that's a subacute detox and residential program here in Santa Ana. And it was at the Runway that my friend Anthony approached me about sitting down and talking today. I said yes, but I didn't ask a lot of questions about what I should talk about. I thought on it for a day or two, and I started thinking of looking at it as looking through the therapeutic lens to support healing and recovery. So, what's the role of therapy in all of this? What does it look like? To me, this means learning how to build insight in order to understand mental health and addiction and how they overlap. It's definitely two separate issues and they overlap. It works to help create change, to support sobriety, and ultimately to learn how to prevent relapse. Therapy can be a benefit to someone trying to learn about themselves since addiction is mostly about survival and therapy is about growth. I think when someone is active in their addiction, they're in survival mode and not necessarily growing. I replayed conversations in my head that I've had with families through the years, asking questions about how to deal with their family crisis and with addiction. The journey is varied, but I think whatever it is for that person, the common denominator, I think, is often shame, fear, and isolation, love, resentments, anger, right? I think shame builds and all of a sudden it becomes a mountain that gets really, really super hard to climb. I feel like the connection to shame is isolation because as shame grows, there's more secrets and embarrassment that leads to feeling really alone and like you're dealing with it all by yourself. And this really denies a lot of resources, education, and connection. I think it makes it seem like there's no hope. And I truly believe that there is hope. There is absolutely hope. Hope and humor are powerful tools when learning how to grow, and they're used frequently in therapy. I thought about it, and I think codependency is a big part of the puzzle too. If you're codependent for someone with an addiction, you know the crazy. You know the heart says one thing, the head says another thing, and fear wins. When someone is codependent, they're trying to help someone else get better. They're trying to help someone else be better. It's such an intense combination of love and fear and anxiety that solving their problems seems like the only way to get relief. If I can solve your problem, my anxiety will go down today. But the price of that is bearing the responsibility of control. And that's a really heavy brick to carry. If I'm putting my energy and resources into taking care of you to keep myself feeling sane, I don't have anything left for myself. And I can't replenish energy because I'm not utilizing it in a way for my own self-care. I'm so focused on helping you. So it just becomes, I think, a vicious cycle. I had a 35-year-old client tell me that his mom called him every morning to make sure he was up for work. I remarked that it seemed like a big responsibility for her. He said she likes to do it. She wants to do it. It makes her feel good. And I was like, hold up, hold up. Your mom likes to get up every morning and call, hoping you're going to get up for work. Yes. So we looked at alternative perspectives as to why his mom might be calling to wake him up every day before work. She doesn't want him to lose his job. She doesn't want him to start using again. She doesn't want him to stop getting a paycheck or not have the structure of going to work because that is when he uses. She doesn't want him to move back in with her. I mean, there could be a myriad of reasons why she's doing this. Her anxiety was driving her behavior to make sure he got up every day. So we looked at starting to transfer that responsibility to him, which is going to also bring up anxiety in his mom, because when we're codependent, we feel like if I'm not in control, it's not going to happen. It's not going to get done. So my anxiety is going to climb more. When a client comes in, the first thing I want to know is, why are they with me? Why are they sitting down and talking with me? We have to look at motivation. Is it external? Is it internal? External motivation involves parents, partners, jobs, judges, someone telling them, go to treatment, go to therapy, go to AA, go find help. You gotta go. Internal motivation is, I want to be here. I know I have a problem. I want to figure this out. I don't know what to do, but I want to figure this out. That's a whole topic within itself. A mom recently told me about her 20-year-old son's addiction. She said that for the first time, he was willing to sit down with a therapist and talk. He was in trouble at home and agreed to go to therapy, which is external motivator, right? He's getting in trouble, and to get out of that situation that he's in, he agrees to go see a therapist. Could be internal as well, I don't know yet. Her son came in and he told me about his history of using, which, not a surprise, was worse than she knew. He said his use had progressed and he had tried cutting down. He shared that some things about his use had scared him. He was worried about his body, his brain, how much he was isolating, that he was losing joy, but he wasn't stopping. He just tried to cut down. What he was expressing at that point was internal motivation. He was wanting to make a change and he didn't know how to do it. He didn't call it an addiction, but he described addictive behaviors, and we looked at that because if we can talk about addictive behaviors, we can start defining it differently, which means including the word addiction. That means we're going to look at it different. He said he hadn't shared his fears with his mom because he felt if he admitted it to her, he wouldn't be able to manipulate her anymore, which was pretty insightful. He said he manipulates his mom so he can keep using or to get away with using or to do things that he wants to do that she thinks he shouldn't be or wouldn't be allowed to do. He also said that he doesn't know how to deal with feeling mad or anxious. He said he can't handle conflict, so he apologizes to make a conversation end, or he gets angry, blows up, which pushes the other person back from engaging with him, and he walks out to avoid it, or he lies and leaves. So he and I, just in this little interaction that we had when he agreed to come in, probably from an ultimatum with his family at that point, we're already identifying anxiety. We're already talking about low distress tolerance. I can already hear problems with communication. I can hear lack of problem solving skills, not knowing how to handle discomfort, how to self soothe. These are all really important issues. And it's very broad, right? We're going to bring it down a funnel until we can define goals together and start looking at interventions to help support making changes. So this helps us to make a goal. We have to explore his anxiety. Instead of numbing his anxiety, which is something he does, he's going to benefit from learning how to be uncomfortable, how to learn some new coping skills, how to practice them, and how to focus on problem solving. We explored his mom's motivation for wanting him to stop using drugs, and he said she loves me and she cares about me. He said, I think she's scared, but it's fine because I'm fine, so she's overreacting. But he did say that he knew his mom, wasn't trying to trip him up to fail. She didn't have malice when they were fighting like two cheetahs, through all of this out of fear, love, and anger, and everything else that gets all jumbled up at the same time. He knew it was coming from a place of love and worry. But his response to her was, you're trying to control me, everything's fine. That scared her more. So the skills to be able to talk or be honest with each other at that point shifts. So just having this conversation with him is an open door for he and I to work with honesty. I'm not judging what's being shared. I want to help him to be the best person he can be. I want him to be comfortable in his own skin, to improve his mental health, to try new skills. I want him to learn how to face addiction, to be accountable, and to risk being sober. When a client comes in to meet with me, I have to hear their story. I have to listen to their story from their perspective. I start bonding by asking questions and looking for more details and building that relationship of trust so we can have compassion sitting in the room with us as we talk. I listen to them and help them attach emotions to their life story. It's important to talk about how they feel so they can improve being able to identify feeling. What it is are you feeling? And if you're stuck, you really can't figure it out. We look to our body for cues. We have physiological responses that help us identify a feeling. But if it's been numbed for a super long time with drugs and alcohol, then we may not be that good at it anymore. So the stomach gets tight and is churning and it feels knotted, or thoughts are racing, the heartbeat's fasting. We can start identifying these to help identify the feeling, validate it, and then learn how to function through it instead of numbing or escaping it with substances. Clients are really encouraged to learn how to take ownership of how they've hurt themselves and how they've hurt others. It takes courage to be honest and to be vulnerable and share moments that are hard to talk about. Because I'm asking someone to look in a mirror and share the hardest parts of themselves with me in that moment so that we can figure out what to do, how to heal, how to take responsibility, how to grow. Guilt is a motivator, certainly. If I do something wrong, I feel guilty. Shame is a different story. It's more about who I am and how I feel about myself. So we're going to start looking at these concepts and separating them while encouraging taking responsibility. Building trust makes room for this process. I think sometimes we even have to battle through this to make space for the truth. We unpack life experiences and explore what coping skills do they have? Which ones are adaptive and which ones are maladaptive? Which ones used to work but aren't working anymore? Maybe when they first started any substance, let's say drinking, they found that when they went to a party, they felt less anxious. Maybe before going in, they just felt really anxious and maybe not sure of themselves. And they found that if they had a couple drinks, they felt funnier or more relaxed or more able to interact with other people at the party, and it felt good. Over time, the progression changed, and maybe now they're drinking alone or they're too hungover to go to work on Monday morning, and then we start to look at other consequences for using. What have they been? Legal, health, financial, emotional, relationships. We're going to pull it all apart and unpack this in a way that makes sense. I always look at it like someone comes in, usually they're in some kind of distress or crisis, or they are willing to look at something that's hard. And it's all in a blender, and the blender's on high. It's just spinning as fast as it can. And one of our first steps is just to unplug that blender, and then it's dump it, and then it's start to pull it apart. So when we're doing this, getting their perspective gives me a chance to help them learn about themselves, but slowing it down so we can make sense of it and then start reconnecting all the pieces. I want to know what it was like growing up in their house. What were traditions or holidays like? Who did they live with? Was there trauma in childhood? How old were they when they first tried a substance? How they do in school? Was learning easy? Was it hard? Any learning disabilities? Um, I had a client who had an undiagnosed learning disability as a kid. And the more we talked, the more I started hearing it. She was really intelligent, very intelligent, clearly very smart, but she didn't see herself as smart. And I've heard from a lot of adults who struggled with learning as a kid, I was life smart, not book smart. She said the other kids seemed to know what they were doing and she felt lost and she started to feel stupid. Stupid. To distract herself in the classroom, she would leave and go to the bathroom too many times. She wouldn't come back quickly. She'd get up and sharpen her pencil too often. She'd distract others by talking. The teacher would get mad and she would get in trouble, and she started to view herself as bad. She'd go home and avoid homework because she didn't understand it, or because she was by then starting to hate school. Her parents told her if she just tried harder, she would live up to her potential, because remember, I told you she's really smart. So she was told she was. So having a learning disability can leave young kids with the cemented thoughts that they are stupid, bad, and lazy. This is a great example of a faulty core belief. It is a belief that isn't true, but found its way into the neural pathways in our brain and made a home. My client said she became more anxious going to school. She didn't like herself very much and eventually found that using gave her a break from the anxiety and depression and thinking that she wasn't as good as everybody else. She was 10 when she started thinking this way. As a child, she couldn't articulate or understand this. She just thought she was dumb. As an adult, she was able to rely on her fully developed brain to challenge and then replace this way of defining herself. We do this rewind and reinterpret of events. We have the luxury of looking back at this 10-year-old, this 12-year-old, this 15-year-old who's now using, this 18-year-old, the life decisions and how they connected to that faulty core belief that was developed in something that wasn't true, but wasn't supported or challenged because it wasn't caught. Imagine if she had had the appropriate interventions in the classroom. Imagine if she saw herself as smart, which was the truth. Even at my own kids' school, I was an advocate, pushing them to test for learning disabilities early on in order to get the proper interventions and accommodations in place so kids wouldn't fall through the cracks. I've seen the vulnerability of mental health and substance abuse issues if we don't help a child develop a healthy view of themselves. We talk about in therapy what the attitudes about drugs and alcohol were when they were growing up. How were emotions expressed? How do they express emotions now? And what about anger? This isn't to look for blame, but to reflect and make a foundation for creating changes that will support growth, living in sobriety, and being healthy. Anger is such an awesome topic, and it could be a whole other talk. Um, we all relate to how hard it is. I think it's ignited by the central nervous system. We have a fight or flight response, so we all have an automatic reaction to it that we don't even control. Neurotransmitters start to bathe our brain natural painkillers come in, adrenaline comes out. My brain doesn't know the difference between a threat coming in this room and someone screaming at me. Our bodies react and respond, and whether it's fight, flight, freeze, that's a whole other thing. But we all have an internal response with anger. So whether we're stuffing it deep down and not expressing it, whether we're passive aggressive with it, um, acting out aggressively, or we're handling anger assertively, we can all relate to the ignitability of it. Have you ever been really mad but not said it out loud, or given the silent treatment to someone, or overreacted and regretted it? You know, even as the words are coming out of my mouth, I'm like, you don't even believe what you're saying right now. But that release really helps to, like, relieve the pressure cooker, I think. Um, I think we can all relate to a time where we didn't handle anger in a way that we wanted because anger is so hard. I also, ask myself, how does it feel when we express our anger appropriately and solve a problem? Figure out what's under the anger, what other emotions are there, and how to deal with them. Because usually with anger, there's something else under it. And that's what we need to focus on and learn how to express. But the anger is such a protective stance. So learning how to do that, we talk about what's anger like. I ask them, when you're in the middle of a crisis, when you're really feeling angry, when you're, just mad, how old do they feel? I don't mean their chronological age. I mean their developmental age. We're talking intelligence versus emotional intelligence. So often the client will tell me that they feel 14 or 15 when they're trying to problem solve, more like a teenager when they're mad, impulsive, angry, lacking skills, overreacting instead of responding or problem solving, relying on manipulation. Then I want to know how they were when they started using drugs or alcohol. Most say in their teens. This is when the dots start to connect. I think it's a beautiful moment in therapy because it's a moment when they start to recognize when they're angry, they handle their feelings and communicate like they did at the same developmental stage they were in when they started using substances. I've heard, I feel like I'm 16 or 17 when I get angry. This is huge insight. I think the addict brain is so similar to the adolescent brain, and the sober brain is much more like the mature adult brain. I think when substances are introduced, we can get stuck at a developmental stage. A parent might ask, why does my 31-year-old, my intelligent 31-year-old, react like a 13-year-old when they are upset or angry or disappointed? Helping them see this about themselves allows for new skills to be developed. We're all capable of growing in maturity. We're talking about maturity and immaturity. But first, we have to understand how to own immaturity and the patterns of behavior that reflect this. This is so great to me because it's like a light bulb moment. I always call them light bulb moments. Sometimes light bulb moments are on a dimmer switch. Like I see someone go, I think I kind of relate to that. Or I see someone go, oh my gosh, I never looked at it like that before. It's not an insurmountable problem to have. It's a very doable problem to start to use the intelligence we have to grow developmentally and push for that maturity that kind of got lost along the way. When we're talking about maturity and anger, we have to explore the difference between a reaction and a response. A reaction is impulsive, it's mood driven. A response is thinking before the words fly out. There's simple new skills that we start to implement, like taking a few seconds, calming down before talking. Um, Even if in the moment someone says something and my brain's like reeling and the words that want to come out are really just like reactive, just taking a sip of water before answering gives the brain a couple of seconds to decide what to say or how to handle the situation. There's a lot of new tactics when it comes to dealing with anger. It's a long list. We haven't even talked about mental health, really. Now mental health. Do they feel stable? Are there co-occurring disorders like anxiety, depression, bipolar? What's going on? Like if we break down symptoms, talked a little bit about it, anxiety a minute ago. Anxiety comes with racing thoughts, a brain that won't shut down, insomnia, rapid heartbeat, feeling sweaty, irritable, constant worry. Depression's filled with negative thoughts. It's filled with fatigue, changes in appetite, sleeping, either too much or too little of both, self-loathing, overwhelming guilt, shame. Have they ever been assessed? Were they ever diagnosed with anything, and was it accurate? I think that's a great question, because sometimes someone will get diagnosed with something while they're actively using, and I don't know if that's accurate. I think we need to have some stable behaviors and some stable ways of thinking and feeling to see what symptoms are still hanging around. But if someone says, "Oh no, I've been anxious since I was 8 years old," like I knew I was anxious back then, it's easier to relate to and to look at. And we have to ask, is there a medical evaluation? Would a medication assessment be a good idea? That would be a referral to a psychiatrist, and being educated on that and when it's a good idea and when it's not and why, and making a healthy decision about that. Walking in and being an expert of your own body while communicating with someone who went to medical school, and she or he is going to give you their expertise, and you're going to share and work together to collaborate to make the best decision. Um, I think a little bit of anxiety is motivating. If I have a really big project to finish, we know we start to feel anxious when we're not doing it. And we also know once we do it, the anxiety is going to go away. But a lot of anxiety is debilitating. Depression can lead to so much shame and self-hatred. you know, Someone might stop showering, they might stop getting out of bed, they might stop eating, they stop engaging in things that used to be pleasurable to them, they isolate more. I also think anxiety and depression sometimes play together in the sandbox like best friends. Racing negative thoughts, that's the depression and the anxiety married together. And I think substances come into play when they're used to find relief by numbing or escaping those feelings. It shuts the brain off. I didn't have to think about it anymore. It's like self-medicating, treating their own symptoms. I think when we talk about trauma in therapy, if a client has unresolved trauma, there are messages in the brain that are rooted in, and the faulty beliefs lead to thinking errors that are hardwired. And it takes time to unpack them and challenge those thoughts. Our life experiences, unconsciously and consciously, shape how we see ourselves and define how we are, and how we're able to cope or not cope. When we process traumatic events, we challenge the thoughts that were solidified because of those events. If a child was abused, the belief is often, I deserved it. I was unlovable. I I wasn't good enough. It was my fault. It is rare that a child is able to say, maybe my parent or the person who was abusing me, or um, that adult in my life wasn't capable of taking care of me in that way. It's always internalized. And I believe that the abuse continues in multiple ways, with self-harm or substance abuse. So trauma has a way of tricking the brain into thinking things that aren't true, and it leads to treating themselves as if it is true. We make space for the younger self to sit with us, and we find compassion and love and thank that kid for surviving whatever that situation was. I feel like addiction is being stuck in survival, and therapy helps clients learn how to grow. So I think it's really important to separate mental health and addiction. to explore the co-occurring issues and understand how they sabotage the understanding of emotions and the ability to cope. We start hunting for evidence that supports being capable of change and recovery. We explore strengths and positive characteristics. And if they can't name any, we're going to find them. We're going to find them together, and we're going to gather proof to show that they're real and start rebuilding self-esteem while learning how to take responsibility for behaviors in addiction. Therapy is about trusting someone with the truth even when it's hard. Clients start to give permission to themselves to be honest, and that's the gift, I think, of therapy. If they can do it in therapy, they can do it outside of therapy. They can practice these new ways of interacting with themselves and people in their life who care about them and who they care about outside of therapy. Rebuild trust, connect with new ways of thinking, setting and accepting boundaries, learning how to communicate, have conflict, and be solution focused, support mental health stabilization while supporting sobriety. We work on identifying triggers, people, places, things, thoughts, feelings, triggers that spark cravings. We have to understand cravings to know what to do with them. We break down so many areas: health, relationships, work, school, volunteer, depending on where they're at, hobbies, interests, community-based support. There's so much support in so many different avenues. Spirituality, all these topics are worth diving into and discussing. The things that I'm presenting to you right now, hopefully, are exposing you to something that might be a benefit or possibly a new way to help your family or to learn and grow. The balance of recovery is a spider web of combining benefits to support being sober. And therapy can be a huge part of that conversation to help someone learn how to be accountable for their recovery. So that, I would say, is kind of therapy in a nutshell. And I think if anything was meaningful to you or if any seed was planted, then run with it. Learn how to nurture that seed and figure out if it would be helpful to you.
That was awesome. Thank you. Thanks, Sue. As I was listening to you, I was thinking, wow, what an important part of the healing process that therapy must be. That a piece that, we talk about our kids getting, needing therapy or what, I just don't really think about it. Like, I can talk to my kid, but 90% of the time when I talk to my kid, I'm talking or asking questions just so that I can tell him exactly what I think he's doing wrong. So I'm not really listening, I suppose. So that was amazing.
You know what,
If
though?
any,
I'm going to tell you something. Me too.
okay,
I talk to my own kids. They're like, man, you're just telling me what's wrong with me, or you're just coming at me. And I'm like, oh my God. Sometimes they're right. Sometimes
right,
it's like, I trust you with the truth. Like one of my kids came at me the other day with that and said, gosh, you're just telling. I thought I was being supportive and helping him see something, trying to guide him in the right direction. And he was like, you're just coming, you're criticizing me so much right now. And I was like, whoa. So you're right. I think that as moms, I go home and I'm a mom.
right.
It helps me to have the skill, the education that I have, but I still do the same thing. So I
So
think
it's
that's
it's
so
natural.
normal. Yeah,
Okay. If
yeah.
anyone has any questions for Sue, you can type them into the chat, and we'll get busy asking her these questions. And while we're waiting, Sue, I have a really important question. My son has mental health issues. Part of them, I think some are pre-addiction, but a lot are, since addiction. Do you
Yeah.
see a lot of cases of, with sobriety that things kind of return to a more normal state?
Yes, I
Okay,
do. And I
good.
think that part of that, that spider web that I was talking about was learning how to cope with some of those things that were there pre-addiction that maybe then got lost in translation and how to deal with. And then just like the disease exacerbated and got bigger because it's progressive, correct? And
Right.
I feel like when we don't know how to deal with something, the problem gets bigger and we're putting it in a closet and trying to hold that closet door shut because we know if we open it, everything's going to tumble out at once. And so, yes, I do think it's very much possible to, one, stabilize. If someone's still using, like coming here to the treatment center, if someone's still using and they come into detox, we're going to metabolize everything that's still in their system out. So we're going to work towards getting them through withdrawing from whatever substances they're using as comfortably as possible so that they can get more clear-headed and start doing exactly what I talked about, for the last 20 minutes or so, trying to like pull apart what's going on. What are the underlying things that are happening here that we could focus on? We have to also consider post-acute withdrawal syndrome, which I think when we normalize that happens, and even scientists aren't clear why post-acute withdrawal symptom happens, but over the next 18 to 24 months, the brain does a ton of healing, a ton of healing. And as it's continuing to heal, it's starting to stabilize. And sometimes that gets kickstarted with medication. I look at it as like driving down a road with a ton of potholes and you're going, you know, 50 miles an hour, but you're hitting all these potholes. There's nothing smooth about it. And sometimes having that stabilization with medication makes it possible to drive down the exact same road, but smoothly. And it's helping the brain to right itself, and that can, like I said, sometimes kickstart it. But we want to look at it for stabilization while building up all these new skills, learning how to reflect, work through the things that take them back to using. Like shame is such a big one, you know.
Right.
So yes, I
Right.
do think that's very possible. So I think it's like anything else when we talk about presenting an idea to somebody, and what I like about this generation is this generation, the kids below, my kids, their generation, they seem much more open to the idea that mental health um, definitely is something that needs tending to. And I see all these public service announcements now with their idols and, athletes and people normalizing it. So sometimes I think it's presenting it in a way that like this is available and it might help you. And it could be like I'll tell someone, you know what, try 2 or 3 sessions. And if it's not right, if it doesn't feel like it's helping you, one thing I'd like to say though is if someone tries therapy and they're like, oh, I didn't connect with the therapist, their style didn't work for me, their personality didn't work for me, that's different. Then it's like, okay, go move on, try a different one. But what I would say is presenting it just as an option and that it may be supportive and give it a go. And if it doesn't help you, then don't go anymore. But I think that it's like we do with anything. We just let someone know that the resource is there and that we're supportive of it.
Right. Right.
So I would say that when the brain is healing itself, if there hasn't been brain damage along the way, if there hasn't been some sort of interruption in the ability for the brain to function the way it functioned prior, we see healing and we see growth. And then I think all these tentacles under it support the change. Because if someone's sober but they still don't know how to deal with anger and they punch walls when they're angry, or they overreact when they're angry, we're still seeing that as part of a problem. Like that's not, gosh, my, saying like, oh, my kid didn't do that before. So some of this is skill building, some of it is being able to grow through the struggles that her son is still experiencing. So but yes, I do believe 100% that healing is possible.
So,
Thank you.
do you think that not working through the issues? My son's still a wall puncher too. So, do you think not working through the issues, even if he's not getting anywhere? I mean, what I mean is he hasn't worked out what's causing him to punch walls instead of um, handle stress like I do, or like
Yeah.
a
I
person
think it's
would.
twofold. I think one is understanding anger and how complex it is. And I was saying how ignitable it is because the central nervous system really does kick in hardcore. It's meant to be protective, right? But then at the same time, if we're not able to harness that energy and create some sort of way to control our own impulses, then how do we learn how to deal with anger differently? So I think it's both skill building, and then it's insightful to understand like where it started or why I do it. And I think they can work at different paces. I think they can also work together beautifully, by looking at ourselves and saying, "Oh yeah, I've done it that way for a long time. If I push you with anger, you back off, and so now I'm kind of not having to engage and deal with it anymore because it's scary. I don't want to be afraid of someone when they're angry, and I don't want
Right.
someone afraid of me when I'm angry. But I know we both have
Right.
that capability.
Right.
I have looking at mental health issues that can create delusions or auditory or visual hallucinations, and then looking at drugs that can induce it and being able to separate if one existed without the other. But what it sounds like you were describing was that there has been meth induced psychosis, that there has been psychosis induced by using some sort of substances. And I would say, I've seen meth induced psychosis, I've seen substance induced psychosis, I've seen someone get more clear headed and, like I said, metabolize the substances out of their system, but those thoughts hang around. And I would say about 10 years ago, I was working with a client who had really pretty severe audio and visual hallucinations and had delusional thought patterns, believed things that weren't true, believed that his phone was getting messages, that people were out to get him, a lot of paranoia. And he was a big guy. He was actually a very large man. He was a young man, but he was big. And so he could be, scary. His parents got very afraid. They'd put a lock on the door, and I watched him in the first 30 days pretty much stay pretty married to it. And then he started to question it. Like he would say, I'm still having these thoughts, but I don't know if they're real. And I would say for him, it was 3 to 4 months before we had some really clear thinking without it. But upon a relapse, it all came back as if he hadn't stopped using. And I know that, it can hang around even without substances, but it can be triggered back pretty severe with. So I think what you're seeing, with the maybe it's paranoid or um, having that psychosis, it's really scary and it does put you into just survival because you just don't know what to expect because it's not reasonable. I'm not having a reasonable conversation with someone and I can't figure out what's going on inside their head. And it sounds like comes and goes with use. He maybe gets a little clean time and then he uses again, and that might be triggering it back. And then we need that sober mind to be be clean long enough to let the medications that are being prescribed to
Yeah.
hopefully do their job. Yeah. Yeah.
Oh, geez.
That's my heart is just breaking with everything you just said. And fentanyl, I was listening to a podcast. It popped up on my phone. I wish I could remember what it's under. I'll send it to Sue and then she can put it out because it was so informative. The synthetic making of it, and it's a terrifying drug. And what I would say to you, being so far away, is that everything I talked about in helping someone dealing with addiction, I don't think this hurts anyone to sit and get the kind of support that maybe you could find in Al-Anon or in a support group, not unlike this one, or therapy, but the connection and the resources to help you because I can hear the heartbreak and the fear and being so far away, you just feel helpless. So one thing I would ask is, have you ever heard of the patch that gets changed every week to 10 days and it shows use? I think it was a
No.
really good boundary that you set, that our house is a safe space for the kids and
Yes,
sanity. And that
exactly.
I'm not inviting you in because then I have to figure out how to get you out, right?
Hmm.
So we're bringing in the chaos into the home, which we're trying to keep where the kids are safe and feel contained and loved. And my frustration is that you don't have a contact within the court system. Like if you can't get a hold of, I think you called it kinship, if you can't get a hold of that person, who do you speak to or where do you go to speak with someone? What the struggle I have
So,
is that you have a very realistic problem and that should partially be solved by the court stepping in and creating a solution. One thing I would say is I would document all of the interactions because you do have a
yes.
judge on your side. And
Hmm.
that's one thread that
Absolutely.
I heard that I think that I would just keep yanking on. I think that you're hitting on just that shame, right? And the systemic shame. It's cultural. It's in our community. We look at this disease differently than other diseases. And then I think what happens is when we have someone in our family actively using, they become the identified patient. They're sucking the energy out of the room. They're sucking the air out of the room. And to keep them alive, I feel like they do become the center of that nucleus, the center of the universe. And maybe there's you know, um, resentments in the family or pulling away or isolation. And I feel like, we start with the individual. And I didn't even get to like, what's it like for like the guy that I was talking about whose older mom was calling him every morning at, the crack of dawn to try and make sure he was up. And we talk about deeper wounds and deeper hurts. And then what would it be like to invite her in and be part of a session? Or what would it be like to have some family sessions and do some healing and some growing and creating some system changes? Um, I think I went off course a little bit with what was being asked, but I can see where when we go down into a family, how disruptive it can be and then how alienating it is. And I think that we have to just keep broadening the scope to change, that path of healing. And I had a guy here a couple of months ago, and he said to me, I'm going back to work, and they knew I was coming to treatment because I wasn't functioning at work. They could smell 4 o'clock in the morning alcohol on me, and he goes, I'm going to go back, and they're going to be like, there goes the alcoholic. And I was like, or there goes the guy in recovery, right? But he's got to own that. We have to start taking, ownership of that growth and being able to accept responsibility for the broken parts while working towards the healing. And we need other people on board to do that. And if they're not able to do that, there may be some boundaries involved. But I understand what you're saying, that, it's like seeking support to survive the situation without having all the proper. It's like if I put you somewhere and said, build a house, but I only gave you a screwdriver, But now we're talking about, okay, how do I use a hammer? And then I can get a saw, and then maybe I can get a power saw, and we're just going to keep building until we can figure out how to engage differently. Your investment in your child being continued to be part of the family despite struggling with the problems that were going on was rooted in that love. And then when we don't feel heard, I feel like we all start to get louder and more intense, and then maybe people start pulling away or pushing away, and then I think it feels crazy because we're trying to get
Right.
them to see it from our perspective.
Right.
So I don't know. I feel like women were primed to take responsibility for everything that goes wrong. That's a whole other talk, that's related to that whole codependent thing. It's like, oh, you were born a girl. That's awesome. You're always going to worry about other people's feelings before your own. You're going to constantly feel guilty for everything that ever goes wrong. You're going to put a smile on your face because you're not pretty when you're angry. And hey, welcome to the girl club. You're always going to be insecure and not think you're pretty enough. Like, I feel like there's a setup in some of this. And I heard when you were explaining, I think some of what you were doing was just so well intentioned, but it was climbing that really high mountain of shame that I was talking about in the beginning. It gets harder to climb.
Okay, well, thank you. We really enjoyed this, and we'd love to have you back because these are, these topics about our children's mental health and coupled with their addictions, something we deal with every single day. So we are grateful for you and all those like you who work to try to pick apart what's happening and help them heal. Thank you.
Yeah. Thank you so much for having me. Really. Thank you
Love to
very
have
much.
you
I would love that.
back.
I would love that. We'll talk. We'll talk.
Okay, absolutely. All
Thank you.
right.
Thank
Good
you.
night. Good night.
Good night.